All right, what's up, everybody? How y'all doing? Let me introduce myself again. My name is Fitz, and I'm an acupuncture physician. This is the first of many videos that I would like to do, just explaining acupuncture, just explaining traditional Chinese medicine and everything that falls underneath it. That's acupuncture, that's tweener, that's herbs, moxibustion, infrared light, diet recommendations, and lifestyle recommendations. Okay, so for this video, I want to focus on some Chinese herbs. All right, as acupuncturists, most of the time we use Chinese herbs and formulas to help our patient gets better. And it could be for any variety of issues. It could be for edema, menstrual issues, headache, and so on. All right. And as acupuncturists, we had to learn a lot of herbs, a lot of saying Chinese formulas. So I'm gonna try my best to. I can't name all of them tonight, obviously, but I'm gonna name some herbs today and just tell you how to how we categorize the herbs and actual how we categorize the Chinese herbs and also the Chinese formula. All right. So let's begin. If you have any questions, you can leave it below. I'll try my best to answer them. But let me just get this first herb out of the way. Okay. So this first herb right now that you're gonna see on the screen is called Sishi. Okay. So Sishi is a Chinese herb, right? Now, the main purpose of this herb is what we call to calm the spirit. What does it mean to calm the spirit? So in Chinese medicine, when your spirit isn't calm or is disturbed, it can cause restlessness, anxiety. It can cause insomnia. All right. So in addition to doing acupuncture treatment, I may prescribe certain Chinese formula that probably contains Sishi as one of the herbs. Okay. So again, this herb is Sishi is used to calm the spirit. In fact, let me just write it down. Calms the spirit. All right. It just all it means is that it's good for restlessness and everything like that. All right. So for instance, if you're talking about the pharmaceutical version of it, it's called like a magnetidum. Okay. So this herb affects the liver channel and the kidney channel, the liver meridian and the kidney meridian. All right. The taste is like spicy and salty type of taste. Right. Now, herbs comes in temperatures. Everything comes in temperatures, but herbs come in temperatures. So, for instance, this is a cold herb. So, if a patient has a cold, is internally cold, I would not prescribe this herb because this herb is going to make that patient more cooler. Okay, internally that is. So it's a cold herb, right? The functions: it subdues the yang and calms the spirit. All right. What does it mean when it says to subdue the yang? All right. When it comes to Chinese medicine, I'm sure you heard of the yin and yang theory. All right. So, basically, in essence, yang is considered more heat, and yin is considered more cool. All right. And sometimes when the yang rises, that patient is going to feel a lot more heat, might feel headaches, might feel red eyes, and that may cause restlessness in the spirit. All right. That's why because this herb is perfect, because this herb is naturally cold. So if the person is feeling internal heat or yang rising, you want to subdue that yang. So you want to go ahead and basically prescribe a cold type herb that's going to be help to calm the yang, to calm the shin. All right. So you get it, right? So this is a theme you're going to see a lot when it comes to Chinese herbs and medicine. I'm gonna mention temperature all the time. If the patient is cold, too hot, if the herb is cold or hot or just neutral, right? So this cold, so this herb subdues the yang and calms the spirit, right? It benefits hearing and brightness of the eyes, right? Again, this herb also can help, with the hearing and also, it benefits the eyes, all right? Aids in kidneys grasping the qi and stops wheezing, all right? in Chinese medicine, we view asthma differently from the Western medicine, or and the lung and the kidney has a connection when it comes to what we call grasping the chi. I'm gonna go into that later on in other videos when I just talk about the foundations of Chinese medicine. But for now, we just know that this herb also, it aids in it aids in the kidneys, grasping the chi. All right. Now, indications. So it's good for restlessness, like I said, palpitations. All right, because internal heat can cause palpitations. All right. Insomnia because of the disturbed shin and the mind is restless. It can cause insomnia in some patients. Tremors. All right. Tremors is definitely more of an extreme case. Right. Dizziness and vertigo. So it treats that because if you have a lot of internal heat, that can lead to dizziness because it dries up the fluids, right? And dizziness, vertigo, what I'm saying, we call it interior wind, right? It's also good for impaired hearing and deafness. Good for tinnitus. Tinnitus is ringing of the ears. It could be high pitch or low pitch. So the herb is definitely good for that. And visual disturbances. All right. So this is a very, 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 very powerful herb, y'all. All right. And it's also good for chronic asthma. Now, is it going to cure asthma? No. We don't like to, in Chinese medicine, we don't, in medicine in general, we don't like to use the word cure. All right. But it can help with people with chronic asthma. Okay. There are also contraindications, just one mainly, okay, for Sishi the herb. Okay. So the contraindication for this herb is that if you have weakness in the spleen or stomach, so as acupuncturist, I have to do a diagnosis. I gotta see. That's why it's very important to get the right diagnosis as an acupuncture physician because if a patient appears to have a weak spleen or stomach channel, so therefore this herb is not good for prescribing. Right now, the dosage again. By the way, I want to make this clear. This is clearly for educational purposes only. I'm not gonna mention the doses to doses is about 15 to 30 grams. Now, usually we prescribe herbs that comes in a formula. Sometimes we do individual herbs for patients, but mostly it's in a formula form. All right. So blah blah blah. Caution is also there's another herb called a Mudan P. Okay, Mudan P. This is the antagonist for that herb. So basically that means that we don't want to prescribe Sishi and Mudan P together. All right. And you can do a whole bunch of combinations with this herb. And I'm not gonna get through that right now. Okay. So if you're talking about the Western medicines of it, this is also good for antifungal. Yes, this herb is also good for antifungal. All right. Also, here's a little note. This is used in Chinese clinic for treating cataracts. Can also treat anemia and high iron oxide. So just in case you know, this herb is used in Chinese clinics to treat cataracts, which is pretty cool, right? Which is pretty cool. And also good, good to treat anemia also. All right. And I mentioned before the herb. This is the anti-agonist for Mudan P. So Mudan P and She should not be used together, okay? Because they're gonna cancel each other out. All right. So this is the first herb I talk about, Sishi. Okay. So again, this herb is good with anxiety, with restlessness, with palpitations, and stuff like that. Let me see if I have any questions so far. You know, if you have any questions, just please leave it, say below. Let me write something, a question for y'all.